there's just so much prescribing pressure. And then that person gets that medication and it's like, awesome, I got my medication. And they go home and they don't know what they're doing.
Knowing how much support is needed, knowing how much support can help people stay engaged, the fact that you can find these centers of excellence, like with Vida Health, that are in digital clinics, wow, right?
Hi, and welcome to Captivating Health Insights. Today's topic is all about GLP-1s, and I'm excited to welcome today Brenda and Navin from Launch My Health and Kelly Rawlings of Vida Health. Welcome, ladies.
Thank you.
Thanks.
I would love if you guys could introduce yourselves. We'll start with you, Brenda. Would love to hear a little bit about your background and how you got to where you are today.
Sure. So thank you again for having me. Very excited to talk about GLP-1s today, but really more excited about my role in bringing food as medicine to the masses. That's what I say I do. And my business is Launch My Health. So I'm the CEO and founder, and our job is to bring food as medicine to the masses, to the everyday person, making it really easy, accessible, and most of all, really fun. We call what we do edutainment, and we're learning about food and how it impacts our health. And I'm a registered dietitian by background, worked in healthcare my entire career, and decided during the COVID pandemic, it is time for me to do this on my own, and I'm going to do it in a way that brings food as medicine to more people so that they can truly find out what food can do for their health.
I love that. That's a new term for me, edutainment,
sorry.
Edutainment. I love it because
Yes.
it has to be entertaining. We're entertained all the time. So
Yes.
if you're going to learn, it has to be engaging and entertaining.
And I think in healthcare, at least my experience in healthcare, everything is so boring. And we tell people
Yes.
what to do, and we need to engage people. We need to empower them to take care of their own health. And so that's what we're trying to do. And I think people truly enjoy and want to be healthy, but they don't want it to be boring. They just kind of shut down if it's boring.
Right. It can't be boring.
Yeah, they got to be a part of it. And food, to me, this is, of course, my passion, but healthy food should always taste good. Always taste good.
And
that's
why
what
eat
we help
it if
people.
it doesn't taste good?
Right. But when you say healthy food, a lot of times people are like, it's going to taste like cardboard.
Right.
And it's delicious.
Right. Well, I'm so glad you're here today, Brenda. Really excited to get into more of the food as medicine movement and how it relates to GLP-1s. Kelly, let's go to you. Would love to hear about your background as well and your experience in this space.
Great, thank you so much. And I'm excited about our conversation today because what could be better talking about obesity, a serious condition, but talking about some really powerful treatments that we now have available to us with this new class of medicine. But as you point out, Brenda, so rightly, it's not just about the medicine. The medicine alone isn't going to get people to the weight loss outcomes they want or the health improvements. It really is thinking about lifestyle, about food, about exercise. So I'm excited to be here.
Yeah.
My background is actually in journalism. I started out working in service journalism and had the great good fortune to start working on a brand focused on diabetes. That was with Meredith Corporation. I loved it. It was so great to write health information for people who were, again, trying to work their condition management or their prevention steps into their everyday life, into fixing meals that were healthful and nutritious for their whole family. So fast forward with my career, I started to read and write about this emerging world of digital therapeutics, where it wasn't just information on pamphlets in a doctor's office or in the pages of a magazine, but something that could be on the website or on your phone, where people are spending more and more time. So I took a step to the American Diabetes Association, got even more immersed into the research, what was happening with obesity prevention, with the prevention of type 2 diabetes. And all along the telehealth world, the digital therapeutics were emerging, and I thought, that's where I want to go next. So I joined Vida Health about 7 years ago. Vida Health is a cardiometabolic telehealth clinic. We started out with health coaching, with online therapy, and with a diabetes prevention program, and in the years since have grown to really focus on cardiometabolic conditions. So helping people treat obesity, helping people treat type 2 diabetes. And of course, GLP-1s are a really big focus for all of us.
Yeah, and I love how you started in journalism with the printed materials, so the brochures, and now it has transformed to websites and tech, and how do we enable this app, and just kind of the journey of this, again, education, and how do we make it more engaging for people so they actually can learn it and apply it.
That's what I love. And I mean, I think about what you do, Brenda, where we're talking about helping people create food that is going to nourish their body and help them with conditions, whether that's high blood pressure, obesity, blood sugar levels that are, higher than is healthful for their organs, for their health, and just do it in that everyday setting where it can be delightful. So I like this mantra. Let's add a little more delight, joy, and fun to what we're doing as we help people improve their health.
Well, and I think, too, gone are the days, as we get into this GLP-1 conversation, but gone are the days where you get a pamphlet from your doctor that just has some tips on it. We need to learn differently and help people, lead sustainable changes in their life.
I'm so excited for this conversation because it's a huge conversation today. We all know that. We hear about it everywhere. We're almost inundated with it. But what we're going to do today, which is what I'm most excited about, is sharing all sides of the issue, showing the pros and the cons and what's new and what's been proven and what hasn't. And we're just going to cover all of it because medication isn't, always good. It's not necessarily good or bad.
It's not the magic bullet.
Yeah, It's not the magic bullet, but it's a tool. And so we're going to talk about what that means for not only consumers and at the individual level, but also employer organizations as well, which you both work with, of course, at Launch My Health and Vida Health. So let's get into the first question. This is for you, Brenda. We're starting real basic. What are GLP-1s and how do they actually work in your body?
So in a very simple way, there's two main actions. Of course, there's many, but the two main actions that I think people need to be aware of, it works first in the brain. And how it works in the brain is you don't feel hunger. So that's a new sensation for a lot of people. A lot of people have food noise, I like to call it. And so they're constantly thinking about food. This helps people not think about food constantly. So it's not that, I need to eat something and you're always thinking about what's in the fridge. So that's the first way. The second main way is that it's helping you feel full longer. So when you eat that meal, you're eating a smaller portion, you feel full, and it takes longer before you feel hunger again. So that's really simplified. It's a lot more complex than that, but GLP-1 is a hormone, and it's a hormone that our bodies naturally make. So we're just giving the body more of that GLP-1 hormone.
Okay, so in the brain, and then it also slows down your digestive system, right?
That's why you feel full. Yep. So it works on basically the GI system and the brain. So those are the two main functions of a GLP-1 medication.
Gotcha. And what are pros and cons, both sides of that issue, the good and the bad?
Well, I think one of the big pros is that it works. We see the data. People are losing close to 22.5% with tirzepatide, 10 to 15% with semaglutide, and so it works. And I think that's the really exciting part. The medications that we've had in the past just have not been. It's been 3 to 5%, but this really works. I think the other thing that's exciting about it is that we're learning now, of course this hasn't been around that long, but it's really helping some other conditions. So it's reducing heart disease, it's improving diabetes. We're seeing research now on autoimmune conditions because it's reducing inflammation, neurodegenerative diseases like Alzheimer's. Now think about the amount of people that have Alzheimer's and the potential impact that could have. So those are all really cool, good things about GLP-1s, but there's the flip side too to that. And I think the flip side to that is that they're very costly, they're not accessible. I think for a lot of people, there's misuse. We have people who are just overweight who are getting it. If you wanted to today, you could go online, fill out a form, and get a GLP-1 compounded delivered to your door tomorrow. And they're not getting that whole lifestyle component to it. So like you said earlier, there is no magic bullet for weight loss, no magic bullet. And it always has to include lifestyle.
And the reason for that, right? Because these drugs are so powerful. They're working.
They're really powerful.
People are dropping pounds, but when people lose weight fairly quickly, as they do with these very powerful medications, you're losing stored fat, yes. You're also losing muscle. That is a known fact in obesity treatment, right? As we've worked with people in the past, whether it's a very restricted, low-calorie diet to lose weight, whether it's a medically supervised program in which you're doing some meal replacements. So while people are losing the weight, and we're cheering that, I'm sure you're worried, right, as a dietitian about what happens with muscle loss, because what does that do to people?
Well, and you get into this weight cycling that will happen. So if you end up stopping the drug, which a high percentage of people who go on a GLP-1 stop the drug, and that's because the side effects can be too much for them, or maybe they don't have access anymore.
Yeah, I saw the stat. I almost didn't believe it the other day. 85% of people are not on a GLP-1 for more than 2 years. So only 16% stay on it. That is a very, very low percentage.
Right. If I could say one thing to somebody who's on a GLP-1, if you are on it, make sure you're doing the lifestyle, do the work on yourself, your mind, body, and spirit, and change your lifestyle to become more healthy so that you can get off the medication if that's right for you, so that you really mitigate the amount of muscle that you lose and you maintain muscle. Maybe even start building. You should be lifting weights. You should be eating a very nutritious diet and focusing on protein. Those are key if you're going to be on a GLP-1. In my opinion, they should not be prescribed unless a person is willing to do those things.
But they're not,
They're
which
essential.
is kind of the scary
They're
part.
essential.
I think that's what we worry about. We worry about everybody getting so excited about the results they're seeing, whether that's on social media or in published literature at academic, research committee meetings. So they're getting very excited about the results. Everybody's very pleased about the fact that we see, less progression to type 2 diabetes. We see protection for cardiovascular events for people who are at risk of those. And I think we're getting really caught up in all the positives without really being looking fairly at some of the negatives. The other thing too with weight loss and people who have obesity and overweight with other complications, this isn't their first rodeo. People have tried many, many things, many, many times, and it all starts to sound kind of similar, right? Eat a little bit less, exercise a little bit more. But for most people, this isn't the first thing they've tried.
Right.
And so I think part of the message too, in sort of a strengths-based way, is to encourage them that the things that they're doing by increasing activity, both cardio and strength, which we recommend, they're actually also helping their body, because the body unfortunately doesn't really like to lose the weight that it's gained over months and years, right? It has a natural response, a protective response to slow down metabolism after a significant amount of weight has been lost, to get more out of the calories the body is consuming. And so that is also going to happen when you lose a significant amount of weight because you've had the benefit of one of these medications or another older weight loss medication. You also have to be really aware that even if you stay on it, but especially if you decide to discontinue, you're going to have to help your metabolism. You're going to have to use the exercise, those lifestyle skills to really help yourself, maintain that weight loss. And we want people to be able to do that.
And let's remember that every person who has a weight issue is different.
Right.
So it really comes down to, and where we're going in healthcare too, is personalized medicine. And so learning about yourself and your body is going to be integral to being successful with weight loss. And so if you're taking or starting a GLP-1, take this as an opportunity. I like how you said, let's look at the positive of this. Take this as an opportunity to really investigate yourself, learn about yourself, what's working, what's not working, and what is the root cause of why you had a weight issue in the first place.
I love that.
It's an opportunity.
What is the root cause?
That is something I think it's really important for organizations to be aware of too, right? They hear a lot about nutrition, they hear about meds, they hear about the exercise. Everybody's sort of like, yes to that. But I think what you bring up about the emotional health, the psychological work that also is very much supportive for somebody who wants to lose a significant amount of weight, that's paramount. I would want to make sure that that is available to anyone who had access to the medicine. At Vida Health, for example, we recognized early on how important that was. So along with nutrition education, exercise support, we're helping people use cognitive behavioral techniques and skills to really recognize their thoughts, the thoughts that can kind of sabotage some of our efforts as we're trying to make changes in eating, the thoughts that can help or hurt when we're trying to talk to people our loved ones, about why we're making some changes, why we don't want to order the large pizza, but instead we want to go for a walk, right? Change is hard for us as individuals. It's also a challenge for the people around us. And without a little bit of that mental health support and that scaffolding of some of that, people have a really hard time. So I love you talking about how important it is to emphasize that as well.
Yeah, it's really, I see it as a tool where if you have the right support system in place, whether it's having a coach to help you get the protein you need, or do the strength training for the muscle mass. And unfortunately, I don't think a lot of people, have that. They don't have access to a coach, or, they didn't get it through their employer. They got it, through one of these companies, they can get it from now and it's usually a compounded version. So there's, also risks there that haven't really been researched yet. So there's just so many different angles of this topic. But I like where, we're showing both sides, and it's really kind of coming down to understanding like what's going to work for you, but making sure that you're fully informed of the risks, the pros and cons, and what do you have to support you from a support system emotionally and physically with the habits that you're going to be successful long term, especially if you do want to get off the drugs because they have nausea and there's other, side effects, even though there's really good things that can come from it too, like the weight loss.
And we were just talking a little bit, right, about how many people start the medication, the GLP-1s, and don't stay on it for a full year or into the second year. But there's also statistics that we've seen about people who are initially starting the medication. One study indicated that about 30% of people are actually stopping. Now, it could be for a variety of reasons. It could be access, it could be cost, it could be side effects, right? More research is continuing there. But about 30% of people are stopping before they even get to 12 weeks of being on the medication. And we know, GLP-1s require a ramp up. So you're not even at your optimal dose before that 12-week period. It can even take a little bit longer for some people, depending on how their body is adjusting. And the fact is that people even so very early into using that medication perhaps don't have the support to give it the full try.
Well, and I think you're bringing up a really good point. This is anecdotal, so this is what we're seeing in our practice, is that people who are on GLP-1s, a lot of times they want to go slower on the ramp up too. But their insurance requires them to use the protocol that it is. So their GLP-1 is not covered unless they do the ramp up that is required by the insurance company. And it's unfortunate because I really think that the medication dosage should be in the hands of the clinician and the patient. And that ramp up should be according to the person because everybody's different. I mean, if all of us were taking the same medication, we would all kind of have different responses to it.
And even the off-ramping, I mean, that's kind of even a different controversial issue where some physicians believe you have to, most people would have to be on it indefinitely. And like you said, it depends on the person, but in others believe, that off-ramping is possible. And so, what do you do for that? How do you kind of determine that as a patient when the data is conflicted?
Right. Well, and what we see in our practice is, I definitely am on the side of, yes, we can off-ramp people successfully, especially if it's paired with lifestyle. And, it has to be. They can't continue to do the same habits that they had before that got them to being overweight or obese, But I think that off-ramping is really an important component. And no matter what, I think you look at any successful team, like a team sport, soccer, whatever it is, football, everybody has a coach and you have a team mate that is helping you too. So we always need support throughout this journey, and it's very difficult. We know over 70% of the U.S. is overweight or obese. So this is not, a onesie, twosie problem. This is, the majority of Americans have this issue. And we also have an even larger issue, which you brought up with Vida, and we work on this as well, but just in general, cardiometabolic health, and 93% of Americans are not metabolically healthy. So we have a problem with that too. So this is, we need a variety of solutions, and I think GLP-1s are appropriate for a certain group of people.
Mm-hmm. I like what you said too about this idea about how do we, for people who decide they want to discontinue, and we have all the reasons we've talked about, whether they've reached their goals and they feel that they'd like to now try life without this medicine, whether they've had just their body hasn't tolerated. And as powerful and as great as these medicines are, somewhere between 10 to 15% of people will not be able to tolerate or not, be able to tolerate the side effects or just not get the response. Not everybody responds to GLP-1s, right?
Right.
So there's going to be some folks who might get started and need to help be eased off. But I think the thing is whatever the reason, I would just really hope that people are surrounded at that point in time with a great care team, as you said. Because all the skills that people are starting to refresh or reinvigorate or learn for the first time about portioning, about food choices, to go for quality foods, less processed foods with a whole bunch of added sugar, salt, or processed fats. All those skills that you're learning that are helpful for weight loss are really helpful to help you maintain your weight over time. Most people, once they stop this medication, are going to see some amount of regain. That's just the facts. We see that, right? And that's very common with any weight loss that's been successful. But what we really desperately hope and that we want to be there and support people with, it's part of the work that we do at Vida too, is just how can we help you at that stage, that next phase, so that you mitigate the regain as much as possible. You maintain those improvements in the cardiometabolic health, the improved blood pressure, the improved cholesterol, even if you do have a little bit of regain. And you have the skills that help you get ahead of it. You notice a little bit of gain. What are some of those skills that you can call on again that you've talked about with your coach, with your dietitian, if you just need to make some tweaks so that you stay in that maintenance mode?
I'd love to shift gears a little bit and think about the employers and how they think about this issue, because it's very costly. And so kind of just thinking about the employers listening in their shoes, running organizations, having employees trying to make those decisions. Do we start covering them for weight loss? Do we continue to not cover them? Do we put prior authorizations in place? So Kelly, can you help us first just understand why are they so expensive in the first place? What's driving costs here?
Absolutely. Well, part of it is just the demand, and part of it are those numbers that we talked about, the numbers of U.S. adults who are living with overweight or obesity. There are millions of them. And so, there's an estimate that there's maybe 138 million, 142 million Americans, if you look at the basic criteria of obesity, the criteria for these medications, who would be eligible if everything else is equal, right? So that's just millions of people, and the demand is so high. Again, why? Because we talked about these things work. People have seen it, and it's been all over the news. It's something that we hear about. And social media, right?
Celebrity.
Absolutely.
I call it the tsunami. It's just a tsunami effect.
Absolutely, yeah.
It really is. It's everywhere that you look. And I want to think about the different options that employers have. So one option is not covering GLP-1s for weight loss at all, maybe still covering them for diabetes, of course, but not covering them at all. Another option is covering them 100% for weight loss and not really having any restrictions. And then there's sort of a compromised option of offering them, but with restrictions in place. So what do you see as kind of those most common kind of barriers that help employers kind of mitigate the rising costs and the risks there, but also supporting their employees? I mean, a lot of people would change jobs to get access to a GLP-1. I think I saw 44% was the latest stat. So
that's right.
What are you thinking for what you're seeing at Vida?
Yeah, what we're seeing at Vida, and this is because companies really, they want to retain their employees. They want to offer their employees great benefits. They want to help employees improve their health, because that is the right thing to do. Also, though, it folds into the work, right? People who have improved health feel better, they are more productive, they are more able to take on the challenges of work and also balance the fact that they're human beings at work. They also have family, they have other interests, right? So, thoughtful companies are really thinking about their values, their population, the health conditions in their population, and trying to think out about how can they provide access. Now this conversation and this thinking process, I really commend companies who are getting into it now, perhaps who don't have GLP-1s as part of their benefits design, their plans, and are really considering it carefully. You're in a great place if you're in one of those companies because there are these options available to you. Like you said, if you want to offer access, you can do it in a medically managed way. That means doing things like your plan design. So is the GLP-1 for weight loss on your preventive tier in the formulary, or is it on a higher tier? Is it subject to deductible, unlike some preventive medicines that aren't subject to deductible? Are you putting a few thresholds that have to be met before someone can start the weight loss GLP-1, such as setting a BMI that is in keeping with best practices and the guidance? So there are all some things in design that companies can do. As those companies are looking at, still being very concerned at the rising costs, there are these additional measures, such as you mentioned, Madison, putting prior authorization in place, whether that is also limiting or going to a preferred network of providers so that only preferred providers with a center of excellence treatment of obesity, like we have at Vida, are the ones who can write those prescriptions, monitor the health, and guide someone through their weight loss treatment. Those methods are all available, and I think that those are things to give a lot of consideration to as companies are considering, do they add this for their employees?
I think that's a really good point that you bring up too, like this center of excellence, because right now what we end up seeing in our practice is we'll see primary care physicians prescribing medication because there is so much pressure too.
There is a lot of pressure.
Patient A comes in and says, I would like this medication, and there's just so much prescribing pressure.
Yep, the satisfaction rating for that clinic.
Totally.
Yep.
And they gotta pump people in and get them through. It's
Yep.
and then that person gets that medication and it's like, awesome, I got my medication, and they go home and they don't know what they're doing. They have no support. They're like, I have to eat more they don't even know. We see them and it's like, it's almost seems like malpractice to me.
I know, but they just don't.
Not to support a patient in that way.
You actually do that, right? You actually help physicians learn about how.
Yeah, we have CMEs and we're training physicians on GLP-1 medications and how to, not the prescribing part, but how to support patients in that lifestyle component.
That's right. And, that's where also it's actually kind of hard. I have empathy for the physicians, for the individual patients, right? Because in most offices, most practices, you have to make a separate appointment with that dietitian if there's even one on staff or available to you.
And if they're even knowledgeable.
If they're trained in obesity, right?
Right.
Absolutely.
Right.
So it's hard to even get that kind of surround sound, which of course, at Vida, we are in the telehealth doing this virtually and digitally because knowing how much support is needed, knowing how much support can help people stay engaged, take the medication as prescribed, and give their bodies every chance to really respond well to it. Making these appointments with registered dietitians for medical nutrition and therapy, for health coaches who can provide other support, and being able to do that digitally, still within some business hours, but really at a person's schedule, working for people who are on shift work, who have different types of schedules. The fact that you can find these centers of excellence, like with Vida Health, that are in digital clinics, wow, right? And so Madison, one other way that some companies have designed obesity treatment and their plan coverage is to look at what's known as step therapy. It's also sort of unfortunately, but rightfully so, called a fail first model. That means when you have a condition that has multiple drugs or drug classes that are used for its treatment, the expectation is that somebody starts with the first one, If that doesn't work or get the results or they can't tolerate, they go into the second one, have to give that one a trial, and so on. The challenge with that is that it can actually delay somebody getting to a treatment that is actually going to work and is right for them. It can sometimes, delay the amount of time, and it just isn't always in tune with what you brought up, Brenda, that each body is unique. How people respond to medicine, how they metabolize it is different. And so that sort of fail first model, requiring everybody to go through so many drug classes, really, when you think about it, perhaps isn't the best answer for what we want with obesity treatment and really helping people get some resolution and get to the improved health. So although there's a place definitely for using lower cost medications, and there are older weight loss medications that for some people can work really well. You're right. They don't end up giving you the 15% or 20% weight loss from baseline, right?
No.
But clinically significant weight loss is still, anything over 5%. For some people, at least getting to that point can be a real positive. So instead of thinking about a fail first model, when we look at how can we make sure that we're managing costs, but also providing access to the people who need the treatment, it's more of a stepwise approach where we do look at lower cost medications. And for somebody who has never trialed intensive behavior modification, maybe we start there. That's what we do at Vida. Then we see where the weight loss, how that progresses in the first very important 30 days, the first very important 12 weeks, right? If we're not seeing somebody approach 5% weight loss from baseline, despite their efforts, that's the time to, forget about clinical inertia, start to figure out whether a lower cost medication is something that will give them the boost and the intervention that they need for their body to start releasing that weight. So what this model does, a center of excellence model like we have at Vida, is to have people come in through a true medical assessment. And for those who really have enough cardiovascular risk or situations in which starting a GLP-1 first is really the clinical recommendation, that can happen. But for people who have not trialed other things such as intensive behavior modification, or haven't had the advantage of even trying one of those lower cost meds, there is also the opportunity to do that. So the right patient, the right treatment, but in a way that is moving forward and progressing.
Yeah, that's so helpful for employers to think about. I want to shift back to the consumer. You had touched on this, Brenda. For that person that doesn't have the support, maybe they just got prescribed the drug and they really don't know what they should be doing.
Yeah.
What lifestyle modification should be paired with a GLP-1 for the best outcomes?
Well, before I start talking about that, because that's my favorite topic, I just want to quickly touch too that I think what you were talking about with the STEP program, I think ultimately for every single person, what we want is to reduce barriers to access. And we need it to be easy. And the more barriers and walls we put up, I have to make an appointment, I have to wait, I have all these different things. It just delays treatment and people give up.
Right.
And they throw the weight flag and it's like, I'm done, I'm out. So I love that there's different approaches. So with GLP-1s and the lifestyle component, there's really two things that we're focused on at launch. And one is ensuring that people know that they have to eat protein. I mean, it's kind of like protein first.
Right.
And so that has to be a priority for someone. How the heck do they know how much protein to eat? I mean, it's so confusing for people. You can Google it and you're going to get all different answers. So we really take into account in that nutrition assessment what's going on with the person, what are their protein needs, and calculate that based on who they are. And then give them the ways that they can consume that protein that fits in their lifestyle. We can't just hand them a sheet and a list of foods to eat and expect them to just be able to follow that. So we're really working within their lifestyle, their cooking ability, their budget, all of those kinds of things. The other thing on the nutrition side is we're really looking at nutrient-dense foods. So if you're on a GLP-1, you're not hungry. As soon as you eat, you feel pretty full, and you're missing meals, and you continue to eat the same crappy food you were eating before, that's not what we see as success. So we're trying to incorporate really nutritious foods where they're going to get those vitamins and nutrients that are really going to nourish their body because they need them. It's essential. And secondly, what we want to focus on is making sure that they are exercising and doing resistance training so that they are at least trying to maintain that muscle mass when they're losing weight quickly, and potentially even growing. And what that does is it sets them up for success for the future. So if they do happen to go off the drug, they're exercising, they've developed that muscle, they're eating well, and they can have that transition hopefully go very smoothly. If they stay on the drug, they're eating the right foods that are meeting all of their nutrition requirements. And then lastly, the thing that we need to focus on that you talked about too is that behavior component. And so we need to figure out what the heck was going on that got them to this point. And are you stress eating? And so we have hunger. We have all different types of hunger. We have physical hunger, emotional hunger, boredom, all different ways. And so we're helping people figure that out and become more aware. So you're learning about yourself.
And your relationship with food.
And
what's the risk of not adding the lifestyle component, losing lots of muscle mass, maybe coming off the drug, not, then having weight cycling, which is very unhealthy, very hard on your body, and you don't have any new habits, and you're actually worse than where you started, which is the scary part. And it's so hard to lose weight. I worked in obesity in grad school with different obesity interventions, and it's so hard to lose weight. Like people, it takes all that they have, and you're constantly thinking about it. It's one of the hardest things that a lot of people
And think about how deflating that is to regain weight.
Oh, it's so discouraging.
There are people who wake up every single morning and that's what they think about. They're consumed by the thought of their weight.
Yeah, it is. It can be very consuming and defeating and really weigh on your overall well-being. So we just want to set people up for success. That's why I love this conversation, to know at the consumer level what you can do, to know at the employer level how you can support your employees. If you want to give them access, we just all need to know these things because there's so much information out there.
And it comes down to developing that relationship. I mean, this is like basic healthcare from eons ago, is developing a relationship with the patient or the client, whatever you want to call them. We call them clients, but it's about developing that relationship and that personal approach that is going to be the most successful. One of the things that we kind of layer in and add into our approach too is getting to, again, that root cause. So it's part of the tree. Why does somebody have diabetes? Why does somebody have an autoimmune condition? And so we're digging in deeper into the root cause of that and trying to repair some of those things that might be like their microbiome, like what's going on in there. Maybe they have some food intolerances that we can address and they're very inflamed from that. So if we can kind of calm that inflammation down, that's going to improve their health too. And it's not saying maybe they're on a GLP-1, maybe they're not, maybe they're on some other type of medication, but we want to do that in a way that's supporting their whole person.
I liked what you said, right, about one of the nutrition guiding principles is to really make sure when you're on a GLP-1 that you're getting enough protein. But what you talk about, really meeting the person where they're at and being very person-centric, absolutely believe in that, and something we practice at Vida. Because, for example, sources of protein nowadays can be really expensive, right? Look at the price of eggs, look at the price of meat, chicken, whatever. So really being aware that even as you're directing somebody or encouraging them to kind of go protein first and eat protein, helping them work out what are their sources of protein, what is available to them. And
is it okay to eat a protein bar? Is it not okay to, can I have protein powder? I mean, people have 10,000 questions about nutrition, and that's why you need to have a resource that is going to help them with their situation.
And I really can't stress enough as employers are thinking about or looking at programs, looking at services, the expert is the registered dietitian who can provide medical nutrition therapy. And so having some sessions or medical nutrition therapy hours with that licensed professional, we really see that in the research as being one of those factors that helps people find success.
Available through your benefits, you mean? Yeah.
Available through your benefits, right?
Health coaches are wonderful at behavior change and helping people achieve their health goals. they are not registered dietitians, and to really dig deep into what other medications are they on, what is going on physiologically with them to get them the best kind of treatment plan.
That's
so
right.
it's a very important part.
So important.
And I like
Yeah.
the fact, it does take a team. I think you said that earlier.
Totally.
You mentioned it too, right? But there's the opportunity, the interventions that only a registered dietitian can do. But the fact to have health coaching available to you as well, that really creates that center of excellence, that surround support. Because that health coach maybe is somebody who can talk to you a little bit about, did you meet your exercise goals this week? You said
What's
you were going to
going
walk
on?
3 days a week for 30 minutes at a time, and I see that you reported you walked 2. That's great. What happened to that third? What can we do? What could help you actually this week achieve some of those activities that support your weight loss? So again, can't say enough for having that team
Yeah,
with
yeah.
the person at the center. Yeah.
And as we wrap up here, I want to let you guys have the floor to say anything else that you want to leave our listeners with. I would maybe ask to you, Kelly, what should an employer think about that is on the fence of how to support their employees in GLP-1s? What would you leave them with?
I would definitely leave them with the fact that these are powerful medicines and the benefit will be really appreciated by employees. So looking for a way that makes sense for your population, looking at the numbers and considering some of these medical management or cost containment strategies. Start at the beginning, right? If you're not offering GLP-1s yet, you have an enormous opportunity to set up a program that will be acceptable to everybody and really helps people lose weight and get the obesity treatment that they want. But you can have some controls over how many people start the med right away. You can put some brakes on that spend trend that we see happening for employers who haven't gotten in front of this, and that we're really hoping that people can get in front of. So again, the right people have access to this great treatment.
Mm-hmm. What about you, Brenda? What would you leave our listeners with?
I think 2 things. One, of course, I have to talk about the lifestyle component, that it is essential. So no matter if you're using a service like Vida or you have people going through their primary care, ensure that they are getting that lifestyle support that they need. So that's, integral. You're really setting them up for failure if you don't have that component in there. And then the second thing that I want to close with too is just kind of bringing up or opening a can of worms a little bit in this discussion, but just asking people to have an open mind about GLP-1s because the conversation can be very polarized. And I think some HR leaders, their brokers, it doesn't matter who you are, but the conversation's very polarized. Some people are so opposed, some people are so pro, and I think GLP-1s for weight loss are so new, and the story is just starting. You're a journalist by background. I mean, the story is just starting.
Right. We're seeing all these new benefits even. I mean, it's just starting.
And we may see some more negatives too. I think we need to be open to that too, and maybe be able to say, hey, we got this wrong, and we need to relook at it. But just keep an open mind and see where the research takes us. And I think this is a great opportunity. I know for myself, my mom passed away from dementia. I think now, oh my gosh, this research that's happening in the neurocognitive space. I mean, boy, would I have loved to have something that would have my mom around today.
Yeah, it's so interesting that it's been shown to show impact for patients with dementia. Recently, drug and alcohol addiction, sleep apnea, maybe more related to the weight loss with sleep apnea, but it'll be so interesting to see what other benefits come, and maybe, like you said, some negatives too.
Right.
That's right.
Well, and for me, I think as a clinician, just looking at, again, this is not from any research, this is strictly my opinion, but when I look at all those benefits that are happening, when you look at what's truly happening, I think physiologically in the body, it's the blood sugar control, because we know that metabolic dysfunction, which is insulin resistance, is happening, is really kind of at the root of all of these diseases that we're seeing, happen. So I think the benefit is coming from that blood sugar control.
I just like also where we've gone with this conversation, right? It's all about GLP-1s, but it's not just about GLP-1s. We have so many tools in the toolkit of obesity treatment. We have learned so much with the research, with the older generation drugs that I mentioned still work for people, with all that we've learned about the behavior modification interventions and what works, what consistent activities help people lose the weight in the first place and then maintain that weight that they want to go for. So I think, think about GLP-1s as organizations, but also really think about giving your population access to world-class obesity treatment and everything that entails.
Yeah, I love it. It's a great point. Well, the conversation will continue. We'll see what unfolds, and maybe we'll have to, circle back around when there's more research and, new conversations arising. So thank you so much for joining us today, Brenda and Kelly. Appreciate you joining me on this topic.
It's been
Thank
a pleasure.
you.
Thank you.
Thank you.